In this video, we shall learn how to monitor a newborn baby who is on oxygen therapy. The overall goal of monitoring is to achieve adequate oxygenation using the lowest concentration of inspired oxygen. Counsel parents about the overall condition of the newborn baby and always ensure asepsis while monitoring. Monitoring primarily involves the documentation of the general condition, the vitals, and the clinical signs of the respiratory distress. Ideally, all the newborns on oxygen therapy should be monitored with pulse oximeter continuously. The target oxygen saturation should be between 90 to 95%. One should document the findings in a monitoring sheet to see the trend of these monitoring. After initiating oxygen therapy, the healthcare professionals should stand bedside for 15 to 30 minutes to note improvement. This improvement can be in the form of improvement in color and saturation, improvement in the signs of respiratory distress, and improvement in the general activity. Once the infant improves, the subsequent monitoring should be every 2 to 3 hourly. Each time, the nurse should document the changes in the monitoring sheet. Ensure that the infant is nursed in supine position and the neck is slightly extended to maintain the patency of upper airway. Remember that the monitoring is not restricted to the infant alone, but also includes periodic check of the oxygen source, flow rate, level of distilled water in the humidifier chamber, and the position of the nasal cannula. Nasal cannula should be periodically checked for visible block. Routine nasal suction is not recommended, however, it may be required in presence of secretions. One may also need to put 1 to 2 drops of saline in nostrils to avoid drying of nasal secretions. Once the newborn has improved, then it is equally important to stop the oxygen administration at the earliest to prevent complications related to oxygen toxicity. We shall learn weaning and stoppage of oxygen therapy in subsequent videos. Now, what to do if infant doesn't improve on oxygen therapy? First, check whether the oxygen delivery is adequate or not by ensuring the oxygen flow from the source by looking at the bubbles in the humidifier chamber. Correct any leak in the connection or in the oxygen tubing. Ensure that the prongs are properly fitted, the nose is not blocked, and the neck is in slightly extended position. Still the baby doesn't improve, then try increasing the oxygen flow to a maximum of 2 liters per minute in nasal prongs. Still, if there is no improvement, then consider CPAP or mechanical ventilation as indicated. In this video, we have learned that one need to monitor and document the general condition, vitals, and the clinical signs of respiratory distress in a newborn on oxygen therapy. Pulse oximeter should always be attached and saturation should be targeted between 90 to 95%. Also, periodically check the oxygen source, flow rate, level of distilled water in the humidifier chamber, and always ensure that the prongs are properly fitted, the nose is not blocked, and the neck is in slightly extended position. If newborn doesn't improve, then rule out correctable factors as mentioned and try increasing the oxygen flow to a maximum of 2 liters per minute via nasal cannula. If still there is no improvement, then provide CPAP or mechanical ventilation as indicated. Thank you.